Hey everyone, it's just Dr. Andrew Orr here. Today I'm actually going to talk about some topics about fertility. As a lot of people know, I do a lot of work with fertility, and I have a master's in reproductive medicine. So fertility and everything that goes with fertility, which includes many conditions like endometriosis, PCOS, and many women's health issues that go with it, are all part of it. It's quite interesting sometimes when I get people that call up and say, look, I want to come and see you for my endometriosis because I'm trying to have a baby, and then I often have to explain to them that if you're going to do that, you have to look at the whole picture, not just your disease state, because when we talk fertility, we're actually talking male and female, and that's not discounting the fact that these days we have same-sex couples, we've got surrogates, we've got single people doing fertility work. So for this purposes, we just talk about things, well, we will talk about the whole lot because it's really important, because it's a big part of what I do. But just for this purposes, when we're talking heterosexual couples, we have to look at both the male and female. We can't just look at the female, because often we get females coming in there, the driving force, and it's all about them. I have to do this. It's something wrong with me, blah, blah, blah. But the real fact is that a lot of the time it actually isn't the female at all. 50% of fertility issues are related to male, and up to 85% of miscarriage issues are related to males as well, due to chromosomal errors and DNA issues with the sperm. And it's something that's very much overlooked. It's something that I talk about quite often. And males are very much reluctant to be part of it. I think that's just due to many factors, conditioning, and guys often think they've got this inherent right to conceive, and that they're born with these super sperm. But the real truth of the matter is that male sperm has declined so much, up to 70% in the last 70 years, that it's at a point where it's actually quite worrying. But what people don't understand is that a lot of males come in to me and say, oh, my sperm's fine. And when I have a look at it, it's not fine at all. And they might be doing IVF. Now, fine for IVF is not fine for natural conception. And we have these couples thinking they're miraculously going to conceive at home on their own and not have to do IVF. And the fact is that the sperm's not good enough for that. It's good enough for IVF, because when we've got IVF procedures, we've got ICSI. And really, if we've got 5 eggs from a woman or more, say you've got 10 eggs, we only really need 10 single sperm. So if that guy's only got 10 single sperm, yep, that's good enough. It's not really, because the other part that I often talk about is that, we can look at a semen analysis, really looks at the outward, basically the formation of the sperm. It doesn't look inside the sperm. So it's a bit like a rotten apple. If you've got an apple that, looks crispy and looks beautiful, and then in the inside it's riddled with worms, it's not a good apple. But on the outside it looks fine. But that's a lot of guys' sperm, and they're wondering why their cycles aren't working. But the real issue that I see for couples is not only is that they're not an equal part male and female being looked at. I suppose it's a little bit of conditioning, unrealistic expectation. I also think it's the big hard sell with a lot of IVF clinics. And we tend to think that because we have modern science now, that modern science can do anything. So when we've got heart issues, years ago people used to die of so many things, but now we've got routine procedures that save people's lives. And we can do miracles with science and surgery and all kinds of things that we could never do before. But unfortunately with fertility, we're actually still living very much in the dark ages still. Not saying there hasn't been huge advancements in fertility, because there has. There's been some amazing advancements in fertility. But at the same time, it's not 100% procedure. And really, you know, at best, it's only about 30%. And what we need for people to understand is that IVF is not a cure for infertility. It's not a cure for infertility. I need to repeat that again. IVF is not a cure for infertility. But at the same time, it allows couples that would probably have 0 to, no chance at all, to maybe have a chance of having a child, falling pregnant and having a child. And that's the beauty of it. But it isn't going to work for everyone. And a lot of people put too much faith into this, that it's a cure, you know, that IVF's the pinnacle. It can fix everything. It's going to give me a baby. And the reality is, for some couples, it won't. And the reality is, for some couples, is that, you know, IVF can actually be a hindrance. There are some couples I know that we've taken off IVF because just not working for them. And, you know, lo and behold, they've gone back to something like an IUI, which is intrauterine insemination, or maybe a Clomid cycle or something like that, or even tried naturally and then conceived naturally on their own as well. So there is all these things. So again, there's these unrealistic expectations around a lot of these scientific procedures just because it is science. But at the same time, we have to pay homage to that, because without it, you know, a lot of couples wouldn't, you know, from years and years back, just wouldn't have been able to conceive. We also have to look at that a lot of people are going down one path. And I was just talking about that with the whole medical side of things, that people are going down the medical route, so to speak, and they're not really doing anything else with their lives as well. And that's not good either. We know that despite and we talk about this with things like endometriosis, and we know despite the best medical interventions, that women with endometriosis still have pain, they still have issues. There's regrowth rates of up to 80% and so forth. So the whole medical side isn't the answer too when it comes to fertility. It's the same with endometriosis. It's a multi-modality approach. It's a team approach. You have to look at every angle and every aspect of one's life. And that is also why I often talk about preconception care. There's enough research and information out there. And look, let's put it the way it really is. It's not rocket science. If you're an unhealthy human being, then it's more likely that you're producing unhealthy embryos and unhealthy eggs and unhealthy sperm. So there is that at the same time. So if you're not looking after your diet, you're not putting adequate nutrients in. And we know that a lot of nutrients have been researched and so forth to help the sperm, egg quality, you know, things like CoQ10 and all that. So there's heaps of things that you can do. We know that weight is a big factor for a lot of people. If you're overweight, you're going to have a lot of trouble. And again, we get these excuses from people, or the unrealistic expectation. Oh, but I saw this overweight person walking down the road and she's got 3 children. What I often say to people is, or they say, you know, that person smokes, they have alcohol, they take drugs and so forth. Yes, that sometimes does happen, but it's not a good example either, because what I often say to people is those ones that have conceived like that are probably, one, they're young, very young. A lot of their lifestyle and their weight and their recreational habits haven't caught up with them yet. And later on, yes, it may not affect their fertility, but most likely will. It might affect them in another way. They might get cancer. They might get heart disease. They might get something else. Whereas other people, their fertility is affected very, very, very quickly. But we do know that weight is a factor, and we know that reduction in weight increases fertility. So you have to look at your weight. And if you are overweight and your cycles are failing time and time again, you have to take ownership of that. And you have to go and do stuff. Like a lot of couples I know have come in that have been extremely overweight, and then they can't, you know, still 12 months down the track trying, and they come back, why? And we go, it's your weight. And when a couple see me, they're given all those tools up front about diet, and they'll do it, you know, wholeheartedly for about a couple of months, and then they stop because old habits die hard. And if you're not on the same page and haven't got a supportive partner and they're not supporting each other, then it all just stops. It's like anything. So you've got to lose the weight. And I'd say to couples that if you had started 12 months ago when I first told you to do this, you'd be 12 months ahead. You would be, I've lost a lot of weight in that time. You could be down to your optimum weight in 12 months. And we wouldn't be having this conversation again. There are those that might need, you know, interventions and surgical interventions for weight, but I personally don't believe in that because then it's creating a whole heap of issues with your gut and your metabolism and surgery and all kinds of stuff that could be, and money and time that could be far better spent on your health, personal trainers, things like that, or counsellors, and it could, those sort of money could also go into an IVF cycle, and yeah, so there's all that as well. Then there's all the other stuff that people forget. You know, I think last night a lovely lady spoke to me and said, oh, I want to know about natural killer cells. And it's one thing that I always get asked about natural killer cells, because when all else is failing, we have to look for something to blame. And, you know, we have to look at everything. And I understand people are searching and things like that, but we now know that natural killer cells aren't what we thought. They're not the big cause of miscarriage that we once thought. They're actually, you're meant to have natural killer cells in your body and so forth. If you want to find out a little bit more about them, I've got 2 really good posts on that up on my website. It just saves me talking about it anymore. And then we've got all these other things that people like. So, you know, some people don't know they have gynecological conditions, so they're going to need some form of investigation. So that's the other thing I see also, is that a lot of people aren't investigated properly. And I've already talked about that in a previous post about the fertility profession not being regulated properly. It's pretty much unregulated. So again, have a look at my post on that, and it'll tell you why as well. So a lot of people believe they're seeing someone who's a specialist that might not be a specialist at all. And that goes for both natural medicine and Western medicine. So don't get me wrong, this isn't just about Western medicine. We've got people coming straight out of college who are from natural medicine and hanging up a shingle and saying, I'm an expert, and have done less than one subject on fertility, and then you're the guinea pig. So that we see a lot of that. And to be honest, I wouldn't probably let 90% of those people near me or you as a couple, and that can actually still be on the Western medicine side as well. So true specialists are very hard to find, and it's like anything, you've got to find someone that does adopt that multimodality approach, has an open view, will do a bit of everything, and if they don't do something, they will recommend that you do all of it as well. That's a good healthcare practitioner, not just a fertility specialist. A good healthcare professional will look at everything and go, you know what? If you think it works for you, then go and try it. And I always say, look, if someone told me that drinking dirty dishwashing water would help my fertility, and they could prove it, not that you're going to prove that, but just an example, if they could prove it, I would go and do it. Because if there's enough evidence and research to back that up, then why wouldn't you do it? But I always say too, there's 2 sides of this when you're looking at fertility. We can look at all the natural stuff. So I talked about preconception care, diet, lifestyle intervention. Stress is one of the biggest ones. Now, people say to me, oh, I'm not stressed. I had a lady in today saying, oh, do you think I'm stressed? And then I do her mood and stress and depression, anxiety, stress score, and she's off the charts. She goes, but this is just me. That's who I am. So she doesn't know any different. And she's stressed. I can tell she's stressed. Stress being sitting next to her. So it's not hard, but to see those things. But it's also on paper, we can show those people in black and white. Yes, you're actually stressed. But the other part is busyness. I talk about this often. Busyness and stress are pretty much the same things, which then can lead to anxiety. And then anxiety it's a big thing. And we know that stress increases your cortisol levels, increases adrenaline, has an effect on testicular and ovarian function, has an effect on your hormones, your dopamine levels, your brain, everything. And suppresses your immune system and everything at the same time. So these are the things we got to look at too. And then when we look at the natural medicine side, and I always say to people, look, if you're doing fertility, go and get some acupuncture and do some things like that. Take some herbal medicine, supplements that have been proven, like I said, CoQ10, and there's L-arginine and L-carnitine and vitamin C and all that kind of stuff. And there's all these things that you can use. But at the same time, we can take all the vitamins, all the supplements, all the magic, I call them the magic potions, because everyone wants a magic pill, right? They want the magic pill. And the magic pill that most people need is called a chill pill. And I mean that in a good way. If you would spend as much time on being mindful and slowing your fast-paced life down and not on that go, 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 that makes a huge, significant impact on your fertility as well. And we see that with IVF. So if we can, bring people's stress levels down. So that's why some people taking things like melatonin and that has been shown to improve pregnancy rates and that, because it works on those serotonin levels. It helps people sleep better. It helps bring down those stress levels. So, when people say, oh, stress has no effect on fertility, well, that is not true. Go and have a look at animal models. Stressed animals don't conceive. And we'll see a lot of that now in the bushfires that we've had here in Australia. Stressed animals won't conceive during a time of stress. And it's the same with humans. And unfortunately now, why we're not being chased, well, some people are being chased by bushfires. Well, we're not being chased by bears and lions and tigers and stuff. We're being chased by the almighty, or we're chasing the almighty dollar, and we're chasing our tails more than ever and chasing ourselves. So stress plays a part. But getting back to the whole natural medicine side, you can do as much diet, lifestyle, all that stuff, which is really important. Preconception care, don't get me wrong, you need to do it. But unless you have all the proper investigations done, that could be a waste of time, because if your tubes are blocked or someone's VAS isn't there or something, like there's a genetic issue, because people forget about the genetic issues. There's over 300 genetic issues that we can test for now, which we use with advanced carrier screening and stuff like that, not just the normal cystic fibrosis and karyotyping and all that, and, Klinefelters and Fragile X syndrome and all that. There's hundreds of things that could stop you falling pregnant, and a lot of people haven't even been tested for them. So they could be the little things. So it doesn't matter if you've got two of you together and you've got these mutations, you're not going to conceive. So taking all those supplements is of little benefit fertility-wise to help you pregnant. It'll help you health-wise and all things like that. Don't get me wrong, it does help fertility. But what I'm trying to say is if you've got blocked tubes and things like that, you're not going to conceive naturally. So this is where you will then need help. So this is where the realms of IVF and all that come in, because now we can do PGD screening or PGS screening, which is advanced genetic screening on the embryos, and then we can discard the bad embryos and so forth. But even still with that, it's still not 100%. So we know that even when we put those PGS and PGD tested embryos in, some of them still fail. So there's a whole heap of things we still don't know. And again, if IVF was 100%, everyone would fall pregnant. So what is the solution? Well, the solution is being realistic about things, because the biggest obstacle that we will find these days for couples with fertility is age. We have people that are deciding to have children later in life, and we know that. So from 35 years old, our fertility starts to diminish. Then from 37, it's on that slippery slope. And then when we hit 40, it's like whoosh, like the roller coaster. It's on a downward spiral. And then we get more genetic errors, so random genetic errors. So even if you're tested genetically and you're fine, and you're chromosomally fine, and you know 46XX and 46XY, your sperm and your eggs together could be producing random errors, and they're coming together, and then you're getting these random errors in your embryos, which are causing what we call aneuploidy embryos, which are defective. So the older you are, the more defects you have, and the more chances of defects, random defects happening. And that's why the implantation and pregnancy rates are lower. So we have to be very, very clear that, you know, the younger that you fall pregnant, the better your chances are. You know, like your fertility is much better when you're younger, except there are the rare cases and so forth that, you know, some people are born without bits and pieces and got genetic issues and all kinds of stuff that will hinder their fertility, and that's absolute infertility. But then we have subfertility as well. So it's a hard one. So I tell people what you have to do. You have to use this multimodality approach. You do. You've got to take a little bit of the Western medicine, a little bit of the complementary medicine. You've got to marry it all together. And I've talked about this previously on the post. Often we see those two medicines fighting. Oh, I'm the best, blah, blah, blah. Don't go here or don't go there and blah, blah, blah. It's bullshit. I'm sorry. It's not working for the best outcome of the patient. And that's why I'm always talking about a multimodality approach. You have to use a bit of everything, and you have to be realistic. You have to look at your diet. You have to look at your lifestyle. You have to look at your stress level. You have to look at the genetic component. You have to look at your eggs. You look at your sperm. You have to look at your gynecological conditions, male factor fertility issues, stress and mood and all that. If you're a stressy person, it's going to affect your egg quality. It's going to affect your sperm quality. And you've got to be real about how much that, even besides the Western medicine, how much are you causing your own fertility issues as well? Because some people are self-sabotaging. I've talked about this year, and I'm passionate about this. Is not judgmental on people, but some people need to be called on their shit, basically, and saying, hey, look, I understand you're going through this tough time, you know, you desperately want a child, but how much of your behaviors and trying to control everything, because I see control is one of the biggest issues with. It's probably more so on the woman side of things. I'm trying to control every aspect, which then causes distress. And that whole distress can stop her conceiving as well. And then, you know, we've got the added factor that just some people genetically and fertility-wise just don't go together. And we see that sometimes people split up, they meet a new partner, and then bang, like that. Woo. And yeah, that's called nature, except animals know who they can and can't procreate with. But we've lost that innate ability, and we don't, you know, we probably still have it, but we probably ignore a lot of it. So I hope that helps explain a little bit more about what I was talking about with fertility. So when people ask me about one single thing and they ring up, oh, I want help with natural killers, oh, I want help with endometriosis to help my fertility, I want that. I always say, whoa, wait up, because a lot of the time the thing they're focusing on or they perceive as their issue for fertility is really not what's causing their fertility issue. It's something far away from that. It could be part of it, but it's not always the thing. So when people ask me, you know, what's the number one cause of infertility and fertility issues, I say, how long's a piece of string? Because how long is a piece of string? There's multiple factors, and you have to look at every factor and every couple individually. And that goes for same-sex couples as well. Sometimes we have to look at the other partner. So we might get one partner saying, I want to be the one to carry the baby. I want to, you know, we're going to get some donor sperm, and, or, we're going to use surrogate and all this kind of stuff. And everything that they thought that they were going to do turns out not to work. So then it might mean that we have to look at the other partner who wasn't necessarily going to want to have the baby and go, well, maybe you can carry the baby, but you can't. And that surrogate that you thought you might going to use, well, that person can't conceive it, so we're going to have to find another surrogate. Or can you carry? And there's multiple factors now. But in saying that, there's more factors than ever that we can have. There's more ways to conceive now than we've ever had humanly possible. All right, I'll leave it there. Don't want to waffle on too long. Thanks very much for listening. I just thought I'd come on and talk a little bit about that. Got home a little bit earlier today, which is always nice to relax. And I hope you are relaxing too. And I hope that explains a little bit more about things on a fertility issue. Take care, everyone.